In the Jenleeion circle, we are discussing a very important topic affecting women's health. Nearly 70 to 80% of women will experience some sort of issue with fibroids by age 50. And today, for more information about this troubling condition, we're talking with Dr. Katsnelson in the Jenleeion circle. First, how are you doing, doctor?
Very good. Thank you for inviting me.
No, thank you so much for being here. You represent the Fibroid Fighters Foundation, correct?
Correct. Fibroid Fighters and USA Fibroid Centers.
Fantastic. Now, there are some interesting facts that you do want people to know about uterine fibroids. Take me there first.
USA Fibroid Centers dedicated to helping women with the fibroid disease. Fibroid disease is probably the most common disease that affects women. And I will explain you in different age groups how that disease progresses. Between ages 18 to 30, 26% of black women suffer from fibroids, symptomatic fibroid disease. Between ages 35 and 40, 60% will suffer. And by age of 50, 80% of black women will suffer from fibroid disease.
Fair to say a ubiquitous condition indeed, yes.
And this disease is very common in white women as well. In the same age groups, 18 to 30, 35, 40, and 50, 7%, 30, and 70 will suffer symptomatically from such disease.
Now let's define the disease and also define the symptoms so that people know what they look for, because a lot of things can cause some of the symptoms, or they talk about difficulty urinating or not being able to empty the bladder or even just pelvic pain. What are some of the symptoms that we're looking for, some of the facts there?
Typical symptoms can be heavy, prolonged menstrual period, the one that lasts a week, 2 weeks, even longer. Women suffer from anemia, from loss of blood, and take iron supplements or even blood transfusion. Other symptoms include symptoms that happen because of compressing other organs, like a bladder, because fibroid tumors grow inside, one can be 30, and they can expand uterus, and uterus will start compressing other organs. And then it can be symptoms they call small bladder, when a woman needs to run every 20, 30 minutes to bathroom to urinate, or there's no small bladder. Bladder is okay. It's just something else compressing the bladder. Or opposite side, compression to constipation, because it compresses to digestive tract. So those symptoms. The most deadly symptom probably is spontaneous abortion. Unfortunately, fibroids, because they occupy a portion of the uterus, they push baby out. And it's a #1 reason for spontaneous abortion, for miscarriages.
Yeah, so spontaneous miscarriages, where incidentally, obviously, the baby is lost. So is there sometimes it occurs because the fibroid may be so big enough or so constrictive enough where it pushes the baby out. And is it correct that in very rare cases, a fibroid can be as big enough to reach the rib cage?
It's big enough for a woman to feel like 20 or 30 months pregnant, 30 weeks pregnant. That happens. It can be very, very large in pounds. So that's but you don't have to have such a big fibroid to suffer. It can be relatively small fibroids. It can be inside the cavity, a little bit towards outside, towards inside. We measure not by size, but mostly by symptoms, how it affects the life, because it affects not only a physical well-being, but also mental. Imagine embarrassment, right? And every time it can be bleeding. Women cannot wear whites. They cannot function. Every time they go out, they think, "Where's the bathroom?" They're weak. It's a mental stress, terrible.
If we were to talk about I'm assuming it might be individualistic, but if we were to talk about the primary side effect that usually shows up that says, "Gee, I better go to the doctor and get checked out," would it be the elongated menstrual cycle, or would it be something else?
I think most common symptom is a prolonged and heavy menstrual period. And what happens, women know they have a menstrual period and it's very unpleasant, but they normalize abnormal. what is unpleasant, what is painful, what is abnormal, and symptoms progress. You know, it's not just overnight. One period is suddenly 10 times worse than another. It's progressive worsening.
Yes.
And at a certain point, women need to understand that it's abnormal, need to check, and check is so simple. Ultrasound, simple ultrasound through abdomen or transvaginal or transabdominal ultrasound, 5 minutes can diagnose the problem. Very simple.
So with diagnosis becomes treatment. What are the adequate treatment options?
So typical options what women start is from painkillers because it's painful or some hormonal therapy. But very quickly it's clear it doesn't work. So other options traditionally include surgery. Either hysterectomy, basically elimination the source of fibroids, the uterus, which is terrible, obviously for multiple reasons. Number one reason that no more childbearing, right? No more fertility, no more things that makes a woman a woman. It's like a castrated man, and it's terrible.
In fact, you believe that there are some instances where hysterectomy is used as the wrong treatment. When is the
80%.
80%. Wow, 80% of cases, women are given a hysterectomy when that's not the route to go. What would be the route to go? And when is a hysterectomy appropriate? Obviously, bearing in mind that we're talking about levels of severity, but...
So let's look at it this way.
Sure.
500,000 to 600,000 approximately hysterectomies are done in this country, in the U.S. Overall. 80%, about 80% from fibroids. Fibroids, not cancer.
Wow.
It's a benign condition that leads to hysterectomy. What are the options? Very good question. Traditionally, another option was myomectomy. It's also a surgery when woman is cut and those fibroids are cleaned from inside. Within 3-4 years, probably half of them will come back. The option that the very best, minimal invasive, is uterine fibroid embolization. It's been known for more than 20 years. It's covered by insurance, and what it is inserting less than 1 millimeter tiny catheter through wrist, like a radial artery, or through groin, and then bring the catheter to the origin of artery where that supplies fibroids. And when we embolize, meaning close the origin of the artery and prevents plenty of blood supply to the fibroids shrink, like stop growing. They shrink, and they just absorbed by the body. This treatment takes 30-40 minutes. Can be done in the office.
Something as mundane as starving it of oxygen, and they sort of recede. That's amazing to me.
It's like stop watering the wheat.
Yeah.
It will just die out and grass will stay. The same thing. And what's interesting, that 5 years ago approximately, we started those procedures in our offices, and I was shocked. So I know the secret that nobody else knows, how well it works, and we started a very organized way to treat those patients, to prepare those patients, and achieve result that about 4,000 cases that we evaluated, less than 1.2% of women ever need, this 5 years that we evaluated, needed another repeat procedure. And we also learned that if the doctor does this procedure consistently more than about 3 months, failure almost never happens. So it kind of makes sense. If you do something many times well, consistently, you get so good in this.
Right.
And it becomes easy and better.
So it becomes clear that the part of what the foundation is doing, obviously, is evangelizing better treatment options like the one that you just described. But with Fibroid Fighters Foundation, what else is it fighting for in terms of uterine fibroids? What's the biggest campaign outside of treatment?
We're fighting for equality. We're fighting for equal opportunity. Because a typical fight of equality, let's give equal opportunity to every human being, man, woman, color, doesn't matter, right?
Yes.
But this unspoken truth that men and women are unequal physiologically.
Yes.
And there's certain things we cannot absolutely solve, but imagine a woman that has a fibroid versus doesn't have a fibroid. Day and night difference. And if you have a tool, a magic treatment, a magic touch that someone comes to the office for, I don't know, a couple of hours, 3 hours, and get this magic touch of healing, and it equalizes the opportunity for the woman who was unfortunately suffering from fibroids. Don't you want to give this a chance and equality early?
Of course, of course. I think that's essential.
And because it's not just a health condition. It's physical, mental, social,
Hormonal,
economical,
yeah.
everything. 35% of women don't have a normal sex life. That's reported. So many don't take no romantic relationship, no family relationship, no kids as they would like. That's terrible.
Yeah, I agree. Wow. Well, doctor, again, thank you for your work with Fibroid Fighters Foundation. I think it's really important. Again, for any woman that is out there, give them 3 things that you would want them to pay attention to or that you would want them to know. And then lastly, let everyone know where they can find more information about the foundation.
So 3 things for every woman to know. Don't normalize abnormal period. If you have a severe, painful, prolonged menstrual period, ask for ultrasound. Second thing is look for solution. Google uterine fibroid embolization. If someone tells you hysterectomy, don't believe. Don't believe until you talk to an interventional radiologist, you talk to someone who actually does uterine fibroid embolization, and find out whether by any chance, maybe 1 or 2%, you are not candidate. Because vast majority of cases, it can be done. It's covered by insurance, wonderful solution. Third thing, tell everyone about this.
Yes.
Because it's a most common condition. So people just don't talk. It's unpleasant to talk about menstrual bleeding, about pain, about miscarriages. Like people feel ashamed or dirty or not. They don't talk about this. The mom suffered from the sister. Everyone is suffering. They feel like complainers. Don't worry about this. Tell everyone, because every person who will know about this might save generation. See, hysterectomy is killing generation. Suffering for 30 years before hysterectomy is killing generation, destroying your life and your potential kids. So don't suffer.
And above all, nothing would be more painful than someone who wants to be a mother losing that opportunity simply because of the wrong treatment. Where can people find more information about the foundation, doctor?
You can go online to www.fibroidfighters.org or www.usafibroidcenters.com.
And there it is, Mario Bonds in the Jenleeion Circle talking to Dr. Katsnelson about uterine fibroid disease. Lots of great information. Go out there and do your research, everybody. Thank you.
Thank you very much.